Hello, and welcome to Mental Health Matters. I'm your host, Courtney Gedeon. Today on our show, we will be talking about depression. We all experience changes in our moods. Sometimes we feel sad or down, but we can recover, and these moods don't last long. However, those who suffer from depression can't always shake these feelings, and these feelings of despair can intensify, interfering and impeding on daily routines, work, and relationships. Joining me today to share her story of depression and mental health challenges is artist Diana Jolene. Thank you, Diana, for being here today.
Thank you for having me.
It's so great to have you here, and I know that many people at home will relate to what we're going to be talking about today. But if we can just jump into it, and
Sure.
If I can ask, when were you first diagnosed with depression, and was this something that you've suffered with your whole life, or was there a specific event that brought this on?
Fortunately, I haven't suffered with it my whole life. Okay. I had a motor vehicle accident in 2011.
Okay.
It was life-altering. And as a result of that, I was left with permanent disabilities. I lost my career, a lot of life changes.
Wow.
So depression was born out of that, unfortunately.
Yeah, some really big changes that happened that really made everything look different too, I'm sure.
Yes.
So other than, of course it did change everything, but how did it affect relationships? Did it affect friendships? How did it affect you?
I didn't realize how much it affected me until I looked back.
Okay.
And for me, it affected every aspect of my life. From how I looked at myself, I actually would stop looking at myself in the mirror because
Wow.
I didn't like what was looking back.
Okay.
I'm a mom of 4. So I did not like the relationships that I was having with my children. I couldn't be a good mom. And just being a daughter, a sister, all of that was affected.
Yeah.
So for me, it was like profound in every aspect.
So when you were in the thick of it, you said, you're a mother and you didn't like what was going on. What were some of your thoughts? What were some of your feelings? Because they say when it comes to depression, it's thoughts, feelings, actions.
Right.
Can you remember what some of those thoughts and feelings were?
Absolutely. For me, I didn't realize I was suffering from depression. Okay. I was really in the thick of it. I was so in the weeds, I couldn't see clearly.
Okay.
I used to, or still write poetry, but I used to refer to it as the swamp. I was almost sucked in, and I couldn't breathe, and I couldn't get out.
Wow.
And I would refer to that in my writing, but I just thought I was just going through a bad period of loss and dealing with all the changes. I did not realize how bad it was until I had to seek help. And through that, I recognized that what I was feeling wasn't the traditional things that you think of depression, at least not for me.
Okay.
I think of depression and I picture a person being sad and just not moving around, and that poster card of that woman on the couch, dabbing her eye, and that wasn't me. I still had kids and I still had a life that I was trying to manage, but for me, depression showed itself through extremes. I was unable to think clearly, focus, really hold a thought. And then at the same time, my brain would not turn off.
Okay.
I was mourning. I was upset, but it showed itself through rage and frustration.
Wow.
I had no patience. And that's why I didn't realize that I was going through depression. And it was going on for so long, so many years, really, before I realized what I was dealing with and how I could deal with it. Before I realized that depression really can consume you. Mm-hmm. It can be different for everybody.
Right.
And I sustained physical disabilities from my motor vehicle accident, but the mental health aspect of what I was dealing with was almost more debilitating than my physical disabilities.
Wow.
Yeah.
So I think that's a really important message, because I think a lot of people, when they think of depression, they think of the person who is sad and who can't get off the couch and whatnot. But it's really interesting to hear that it showed up differently for you.
Yeah.
The people in your life, your husband, your kids, did they communicate to you? Did they say anything to you? What was that like for you?
I didn't realize that everyone was tiptoeing around me until later on, and I started to see clearly, and I was sort of falling back into my old self, that they confided, that they were scared or they didn't want to upset me, or I was really angry a lot.
Okay.
And that really bothered me because the last thing I'd want is to come across as like unapproachable or oh, don't upset her.
Right.
What I learned though, as I still deal with depression till this day, and it's important for me to come on here and just look as I usually do, because you see people every day, you don't know if they deal with depression or not. It's invisible.
Exactly.
But for me, it was important to communicate with my family and say, as I continue to deal with depression, today's a bad day. It's not you. Just know that I'm dealing with something. And then they recognize that, okay, it's a bad day for her. It's not about us. None of us are going to take this personally, and we're just going to give her the space she needs until she kind of gets out of that swamp.
And I think that's a really important message too, because people who do live with someone who are going through depression tend to internalize it, don't they?
Yes. It's embarrassing to say, I'm struggling. I'm not okay.
Right.
It's hard, especially as, for me, as a woman that I was in the corporate world, I worked very hard to show that I can manage any situation that any person could, male or female, and I could do it all.
Right.
And it was a humbling experience following my accident with everything that I had to deal with. But saying that I'm not okay today is okay.
Yes.
And saying that I'm dealing with something that's beyond my control, but I am dealing with it, is okay.
Yes.
And that's the point of ending the stigma, is to be able to say, yeah, I suffer from depression, and not be embarrassed.
Right.
Whatever age you are, whatever career you're in, however successful, doesn't matter.
And I think, you know, taking the shame out of it, whether we're talking about depression, anxiety, addiction, whatever it may be, once we can take the shame out of it and just look at it for what it is, you know, secrets keep people sick, right? So I think by you coming forward and, you know, I think it's amazing what you're doing for mental health.
Thank you.
And we will be bringing you back to talk a little bit further about all of the things that you're doing for mental health, because you are doing quite a lot for it.
Thank you.
And some really great things. So we're going to go to commercial break, but when we come back, we will be speaking with Gary Dierenfeld, who is a social worker. And don't go anywhere. More mental health matters when we come back. Hello, everyone, and welcome back to Mental Health Matters. I'm your host, Courtney Gedeon, and today on our show, we are talking about depression. I have a wonderful guest who's going to help answer some of our questions about depression, social worker Gary Dierenfeld. Gary, thank you so much for being here today.
Great to be with you.
Now, Gary, I have a question, because what is the difference between depression and feeling sad? Because we all feel sad from time to time. Can you clarify that for us?
Yeah, absolutely. You know, sadness, oh, I didn't get my way, I'm feeling a little blue, it'll come and go. It's not all-encompassing. We've all experienced that.
Yes.
Depression is a more overwhelming feeling.
Okay.
It tends to be all-encompassing.
Right.
And it overtakes us and impacts our ability to some degree or to greater degrees to interact, to carry on with life.
Okay.
So it's much more pervasive, it's bigger, and it overwhelms us.
Okay, so Diana was just on our first segment, and she was mentioning that she was feeling some different types of feelings, which might surprise some people, that it's not always just sadness, anger.
That's right. You know, for some folks, depression shows itself as irritability.
Okay.
Particularly in children, by the way.
Oh.
So it's not that child who's sitting quietly on the couch. It's that child who's kind of cantankerous, can't sit still, irritable. In that child, that can be depression.
Wow.
And so too for some of us as adults.
Okay.
And it puts a pall, I like this word, it puts a pall on things. And we're dealing with the world through our mood. The other piece of that, and your first guest hit it well, you don't always realize you're in it when you're in it.
Right.
You're just acting from it.
Right, exactly. So what I'm understanding is that it seems like depression is on the rise. Is this something that you're seeing when people are coming to you? Are there more complaints of feeling depressed?
We are seeing more depression. It's anxiety more that is on a greater rise than depression, although we are seeing a rise in depression.
Okay.
And, the challenge in diagnosing it is figuring out what's underneath it.
Okay.
What may have given rise to this depression? Is this something from an early trauma in your life?
Okay.
Is there other folks in your family, extended kin, who have depression where there's more of a biological basis?
Okay.
Was there something, a current or near trauma in your life that has overwhelmed you? It's really important for us to understand what has given rise to that mood, to that depression, because as we understand what gave rise to it, then we focus on treatment.
Right.
And so we don't treat all depressions the same.
Okay.
Some will respond really well to medication. Some will respond really, really well to different kinds of counseling, depending on how we understand the depression. And some will require a combination of both.
Okay. So if somebody comes to you, say they're not feeling all that great, they're concerned that they're depressed, they come to you, what can they expect for someone who's never gone to therapy before?
Great question. And if you've never been to therapy before, you want to start with someone who's going to ask a broad range of questions.
Okay.
Get to know you, get to know your life, get to know your upbringing, because we really want to assess, is this depression from a biologically mediated source? Genetically you're predisposed. Is it from something going on in your family?
Right.
Is there conflict at home? Is there violence? Is there loss? Is there grief? Or what are the words inside your head? Some people grew up with, the finger pointing at them, a sense of shame, and they internalize these words in their head that create their own depression.
Wow.
So again, depending on how we understand what gave rise to it, we're going to treat it differently. And so you want to meet with someone who will take what we call a biopsychosocial perspective.
Right.
To understand it from all those three areas. And do we choose from, number one, number two, or is it a combination of all three?
Right.
Again, that will lead to the treatment plan.
Okay, so what I've heard is that there's you're talking about the biopsychosocial.
Yes.
I've also heard that cognitive behavioral therapy is quite a common form of therapy. Is this something that we treat depression with? Is that something that you find helpful? Or?
So that is one modality. That is one kind of counseling. So in cognitive behavior therapy, we're going to say, what are those thoughts inside of your head?
Right.
How are you managing your behavior? Can we help you think of other thoughts to, in a sense, counteract that?
Yes.
Can we help you engage in other behaviors? As we think differently, as we do differently, we can feel differently.
Right.
However, let's say your situation is related to violence in the home.
Yeah.
You can do cognitive behavior therapy till the cows come home.
Yes.
It's not going to change the social situation giving rise to your depression.
Right.
So that's why we need to understand from a number of perspectives, because then the counseling is going to be, how are you managing at home? Tell us about your interpersonal relationships. How can we help you? You may need couple counseling or marital counseling or parenting supports in order to address those issues from a different perspective.
Well, it just seems like it's so individual, right?
There you go.
Everybody's situation is unique.
There you go. So we talk about this thing, depression, as if it's one thing for all people, and it just isn't.
Right.
And where people get stuck is where they think it's one thing for all people. They choose their treatment, and they go down this path, and it doesn't help.
And then it probably makes it worse.
Well, exactly. If it's not helping, you're not getting better, you will feel worse. The depression flourishes. So it's really important to first get a good assessment.
Okay.
And then from the assessment flows the treatment. Many people run to treatment first.
Okay, interesting. Wow. Yeah. Well, you mentioned about children, and I actually never thought of a child. When you think of children, you have this view of them, and you never really think that they're depressed.
Let's look at this pandemic.
Yeah.
Okay. How many children have lost their community, School is their community.
Yeah.
That's where their friends live, their friendships live.
Yeah.
So many children these days are experiencing depression. It is coming out as frustration, agitation, and parents are trying to deal with, why is my kid a pain in the rear end?
Right. Yeah.
It's depression.
Wow.
And so how do we help them to cope? How do we help them to connect?
Yes.
Because when that kid is a pain in the rear end, punishment will not sort it out.
Yeah.
But maybe a Zoom call with a friend
Okay.
may.
Wow.
Okay? So again, how do we understand that? And then we go to treatment.
Yeah. Wow. I never thought of that before. And you're right. The way that the child is acting, it's not just because they're a pain.
They're upset.
They're going through a lot
and
too.
And it comes out behaviorally in our kids.
Right.
Typically.
Yeah. Well, I know that anxiety has definitely been on the rise too.
Oh, yes.
But depression, I never really thought of that. So if there's a parent at home that is resonating, I mean, what's their first step? How can they help their child? Could they reach out to you? Do you do counseling with the mom or dad? And
typically, for children, we counsel through the parents. Yes, you can put your child in counseling.
Right.
But the counselor isn't toe-to-toe with that child, 24/7. The
Right.
parent is. So as we help the parent to understand the child's experience, the parent is better able to meet their needs. And they're there day-to-day, moment-to-moment.
Right.
So working with the parents. If you don't know who to reach out to first, reach out to your family doctor.
Okay.
Okay? They're not necessarily the counselor for you or the child, but they are the clearinghouse,
Yes.
in a sense, of here's what I think is going on, here's where you may want to go.
Okay, yeah. Well, it's just, it's so enlightening just to hear how you would go about it first, that assessment. That's so important. And then you talk about the treatment.
Yeah. And with respect to treatment, we also have to consider medication.
Okay.
There are those folks for whom medication is literally a lifesaver.
Okay.
Now, whenever I talk about medication, there will always be those folks for whom medication didn't work.
Right.
But they are actually far and fewer between.
Okay.
So let's not throw away that option either.
Let's talk more about it when we come back. Don't go anywhere. Mental Health Matters when we return. Welcome back to Mental Health Matters. I am your host, Courtney Gedeon, and today we are talking about depression. I am joined by my wonderful guests, artist Diana Jolene and social worker Gary Deernfield. Thank you again so much for being here today.
Thank you.
When we were ending our last segment, Diana, Gary and I were talking about how to get through and how to treat depression. So I'd love to hear a little bit about how you got through your hard times.
For me, there's no clear-cut formula, unfortunately. And for me, I did exhaust everything.
Okay.
I did attempt to do the medication route. I did attempt to do the therapy route, psychiatrists, psychologists. There's a big difference between all.
Sure.
And for me, in the end, it was first and foremost acknowledging that I was dealing with something and then learning to deal with it in my own way.
Okay. Now, you also are an artist.
Yes.
So did your art help you with getting through? Can you tell us a little more about that?
Absolutely. My art has been a part of my life, my entire life, as far back as I can remember.
Right.
But your life becomes busy and you sort of put your hobbies and passions behind. And fortunately, I was unable to work, and it allowed that time for my art to be born. And I just found that I was able to create, but without rules, and I was able to create based on how I felt.
Right. So I think we do have some examples of your artwork here today.
Yeah.
So I think one of the ones is the one that's on the screen now.
Yes.
This is more of an abstract piece.
Correct.
And you've also done something amazing too, which is you've worked with sick kids, and I love this story.
Yes.
Can you tell us a little bit about that?
Yes, absolutely. I know that the depression and anxiety is on the rise. What I didn't realize is that it was on the rise for our youth today. And I'm a mother of 4 from 3 to 22. And Sick Kids released a statement saying how it's the pandemic has made it even worse.
Yeah.
And this was based on a survey of children from 2 to 18.
Oh, wow.
So I remember, like, clearly putting my son to sleep and thinking, well, what am I going to do? How can I make a difference?
Right.
And I decided to contact them, and I partnered with Sick Kids and created a limited edition T-shirt and long sleeve.
Yes.
And where proceeds of the sales go to Sick Kids Hospital.
That's amazing.
And I specifically asked, and they've agreed that it will go to their mental health youth initiative fund.
That's amazing, Diana.
Because it's a program that they're trying to build more into, because it is a pandemic.
Yes,
and
absolutely. Well, we heard from Gary, you know, what's going on with our kids, and
it's taken over. That is the discussion these days.
Yeah.
Diana, if I may, I want to say to you, we've never met before.
No.
I like you.
Oh, thank you.
And here's what really resonates for me in terms of what you had to say. Change came when you owned your depression.
Yes.
Okay, so after all the counseling, after all the medication, it's when you, I think, moved past the stigma.
That's right.
Owned it, you're here, you can put it out there.
Yeah.
To me, you're a hero for doing that.
Thank you.
Yes.
And that's what we want people to do. The degree to which you can own it, now you can deal with it.
Yeah.
exactly.
Okay? So I think what you said, spot on.
Thank you so much.
Yeah.
I think, like, if you have a headache, you take Tylenol. If you have an inflammation, you take an anti-inflammatory. For depression, it's not easy, but if you're addressing it, however it works best for everyone, and whatever works for everyone is fine. But for me, it was just addressing that, okay, I have this, it's not going away. I have tried everything conventional, and now I'm just going to do me.
Diana,
and however that works out.
If people are looking to get in touch with you and learn more about your artwork and your story, where can they find you?
Perfect. They can find me on my website, which is www.dianajolene.com, or on all of the social media platforms. It's the same handle, which is Art by Diana Jolene.
Wonderful, wonderful. And Gary, you are a wealth of knowledge, a wealth of information. It's so wonderful to have you on. People watching today, if they're wanting to reach out to you, how can they do that?
Sure, through my website, yoursocialworker.com. Follow me on Facebook. I'm posting 2 to 5 times a day on mental health issues, on social policy affecting mental health, on parenting, relationships. I'm an obnoxious Facebook person.
Well, you've certainly been doing this a really long time, and it's been an honor to have you on. And thank you so much for sharing your story. I know that ending the stigma is part of what you're wanting to do, what I'm wanting to do, and obviously, Gary, what you're wanting to do as well. So thanks, guys, so much for being here today.
My honor.
Thank you so much at home for tuning in. This is Mental Health Matters. Please make sure to take care of your mental health and make it a priority. Looking forward to seeing you next time. Take care.